You're listening to Health Professional Radio. My name is Wayne Bucklar, and today joining me is Rebecca Naylor. Rebecca's the CEO of the Australian Breastfeeding Association and joins us from Melbourne in Australia. Rebecca, welcome to the program.
Thank you.
Now, Rebecca, Australian Breastfeeding Association is one of those names that kind of says what it is you do, but can you fill us in on what the association does and what geographic area you service?
Yeah, of course. So the Australian Breastfeeding Association works with women, the community, government and health professionals to improve breastfeeding rates in Australia and to work towards a community in which breastfeeding is seen as a cultural norm. So we do that in a range of ways. We run information and support services directly for women through a national breastfeeding helpline, face-to-face groups, evidence-based information and resources. With health professional education, both in seminars that we run once a year and also a diploma in breastfeeding management. An accreditation program for businesses, the Breastfeeding Friendly Workplace program, that assists businesses to support women to continue breastfeeding when they return to work. And then, of course, advocacy, where we work with government to ensure that public policy progresses the aim of being a breastfeeding inclusive community. So our services to women in particular, and also our health professional education, is run across the country. So we have groups in every state and territory. Our helpline's a telephone line, so that's accessible for all women living everywhere, doesn't matter where you live. And then our health professional education is run around the country. Each year it varies slightly, but we run seminars in many states and territories around the country. It just varies each year.
Now, I have to admit my days of being concerned personally with breastfeeding are many, many years ago. Do the problems that used to exist 30 years ago still exist, or has the world changed?
I think there are many of the same issues that persist. So we know that around 96% of women initiate breastfeeding, but by 3 months, 60% of them are no longer exclusively breastfeeding. So those rates haven't improved. And so we have a very big challenge on our hands to ensure that women feel comfortable to breastfeed in public, that they understand the importance of breastfeeding, that they have the right support to do it, and that they have the right information to make, the choices for themselves, free of marketing material.
Yes, that last one is quite an issue, isn't it? Marketing is, of course, so powerful these days and so influential.
More and more so now that we're online, for example. It's very easy to be inundated with commercials, for example, for infant formula. And whilst women, of course, have a right to choose how they feed their baby, and nobody would suggest otherwise, what we would like to see is that women are able to make those decisions based on the evidence, not based on material marketed by a manufacturer. Yes,
and one of the things that's affecting lots of areas in health is that some things don't have a commercial benefit. And I guess there is no one out there saying, let's spend millions of dollars on promoting breastfeeding because we can charge $1.50 for each one of those we sell. And that's in all sorts of areas through pharmacy and exercise and fitness and obesity, a range of health issues. The lack of that counterbalance to the marketing push is something that a lot of people have been talking about.
Yeah, that's very true. And so health professionals play a very important role in giving women evidence-based information that to help make a decision free of that material, based on, in fact, what the risks might be of not breastfeeding and the improved health benefits that come with breastfeeding. So health professionals are really key to helping with this issue.
And as I guess Rebecca, about 95% of our audience are health professionals of one kind or another. Is there a particular message for them that you'd like to get across?
Yeah, so I think the message for health professionals is that they are a very important part of the system, part of the support system in supporting women to breastfeed. So they will often be key at a really important point. I'm stressed, I'm struggling, I don't know whether I should keep feeding. A lot of health professionals, so maternal and child health nurses, midwives, GPs and so on, are the professional that woman's speaking with. And so ensuring that they're up to date with the evidence around breastfeeding, that they're giving that information to women and really making sure that women have the support they need to make that decision well is really critical. And ABA can really help them make sure that they have that evidence so that they're really well armed in ensuring that they can give that good support to women. Now,
when we finish the interview, we'll get the contact details on the website, but you did mention that there was a training program and accreditation?
That's right. Yeah, so we have the Health Professional Seminar Series for 2016 begins in March, and we're running seminars this year in Perth, Adelaide, Sydney, Brisbane, Melbourne and Hobart, so all over the place, as well as running some webinars. So they can come to our website and it's easy to find the information about the seminars. So we'd really encourage as many health professionals as out there to come along and come either to the seminars face-to-face or register to attend online. And then if there are organisations that would be interested in becoming breastfeeding friendly, so, any organisation can qualify for doing that. Again, if you just come to our website and look for the Breastfeeding Friendly Workplace Program, we'd really be interested to support you to ensure that workplaces are supportive of women returning to work and continuing to breastfeed.
Rebecca, one of my favourite questions in every interview is about misconceptions. And I guess in every industry and pretty much everyone I've spoken to, there are always misconceptions that amongst customers, clients, patients. What are the misconceptions in your field that drive you nuts and keeps you awake at night?
So I guess the thing that concerns us the most and me the most is that there's a perception amongst some that breastfeeding isn't necessary anymore, that we can replace it with a different form of feeding and that we can do that without consequence to the health of infants, children and women. And of course that's in fact not the case. So we know that when we don't comply with the WHO and NHMRC recommendation to exclusively breastfeed for 6 months and thereafter for at least 12 months, that puts infants at risk. And we see with increased bottle feeding rates, increased risks of gastrointestinal infections, hospitalisations among infants, ear infections, SIDS, childhood obesity, and for mothers who don't breastfeed and for exclusively and for that length of time, then we see increased breast cancer rates and increased ovarian cancer. So my worry is that we've kind of become a community that's lost sight of that, and that we think that it's just totally fine to, as a community, holus bolus, replace breastfeeding with infant formula, and we can't do that without understanding that there are significant consequences. And so we would love to see the community supporting women to breastfeed and really helping them do that by being supportive of them when they breastfeed in public, by making your workplace breastfeeding friendly, by ensuring that if you're a health professional that you're giving them evidence-based information and referring them to support services like the Breastfeeding Association so that we can see those breastfeeding rates increase.
Now, it does sound, Rebecca, like that's a misconception that we absolutely have to do something to dispel a little bit. So today I hope we've been able to do a little bit of that with our audience. For people who do want to get in touch with you, the website is www.breastfeeding.asn.au, so that's Breastfeeding Association AU. Is there a phone number people can get hold of you on?
That's right. So the head office number is 03 9885 0855.
And because I'm always getting in trouble for not giving people enough warning to get their pencils ready, can you just give us that number again, please?
03 9885 0855.
Rebecca, thank you very much for your time. I realise you've been busy and it's been a pleasure having you on.
Thank you.
If you've missed my conversation with Rebecca Naylor, the CEO of the Australian Breastfeeding Association, the good news is there's a transcript on our website. You can also hear a recording of the interview on both YouTube and SoundCloud. My name is Wayne Bucklar and you're listening to Health Professional Radio.